According to Pew Research Center, half of workers say they prioritize jobs that have employee-paid health insurance. In fact, 1 in 5 have considered a career change to seek better menopause coverage. Priority Health is partnering with the online platform Carrot Fertility to change that. Joining us now to talk more about that partnership is Alicia Coronas from Priority Health. Thanks for being here.
Well, thanks so much for having me, Terrence. I appreciate it.
Hey, we're glad to have you. So we see that the need there is pretty great. Can you tell us more about this partnership and how this came to be?
Yeah, absolutely. Well, like you said, there's really a lot of people that can benefit from this type of support. And so at Priority Health, we look to say who could partner with us to really provide that end-to-end support for members, whether that's a phase of their life that they're at pre-pregnancy or pregnancy, parenting, menopause. And what we found was that Carrot Fertility was really the right partner for us to do this. And we're really aligned in our mission because the goal of this program overall is to say, how can we help support people in these phases of their life, help give them access to affordable care, and recognize that this is something really personal for people, and we want to be able to support them along the way.
It's very personal. Alicia, these conversations have been had even leading up to this. Can you tell us about the decision to act now? What was behind that?
You know, this is something that we've looked at and we've heard more and more just about the opportunities that can be provided. And in finding the partner like Carrot that creates such increased access. So there's digital tools, members can engage over the phone, on a digital app, talk directly or message over the phone. So there's just a lot of opportunity now. And as we've been out talking to employers, this is a program and a benefit that they're really excited about, something that they know will be really attractive to their employees. So we think the timing's great.
Yeah, great timing for sure. And like you said, a lot of people do need these services. Who would you say benefits the most from this change?
You know, there's a lot of people that can benefit. I think first people hear fertility and they're thinking about women. We know that 1 in 6 couples experience infertility, according to the World Health Organization, but it really does impact the entire family, and it impacts people throughout phases of their life. So we're looking at reproductive health, we're looking at hormonal health, parenting, adoption support. So we believe that this is going to be a support that a whole range of employees can benefit from.
And I'd imagine there's some kind of sense of pride there, knowing that you're offering these services when there are people who are considering a complete career change just based off of the kind of help that they can get depending on what job that they're working.
Absolutely. We're really proud and excited to be able to bring this program out. Like you said, those are big decisions being made. These are personal decisions. It's a challenging time in people's life. Someone's actually thinking about, looking at a new role or what role they're going to take because of this type of benefit. I think it's a great way that we can partner with our employer customers to just really create more depth for the programs and the benefits that they're offering and allowing us to serve employers and employees across Michigan.
And I imagine that the partnership is going to grow and evolve. Where are you hoping to see it go just as a company in the future?
Some of the things that we have looked at, in addition to the services that are providing guidance and navigation and education for people, would ultimately be how does this then help support employers increase their benefits and coverage? We want to look at different ways that we can interact with people through any channel that they're comfortable with, a digital channel, on the phone. So there's a lot of places that this can go.
All right, last question before we let you go. Where can people find more information?
Certainly, if an employer is interested, they can always talk to their account manager at Priority Health or their sales agent. And if members are interested, they can talk to their HR department at their employer. And we'd love to help get more information out there.
All right, Alicia, thank you again for your time. We appreciate it.
Thanks so much. Appreciate it.